if each of you could just give a sentence or two on, in 6 months' time or whenever the NHS is starting to get back to normal, how do you think they'll start to deal with the backlog and those sort of forgotten patients that are missing out at the moment?
I think it's about redefining a new normal. When we come out the other side of this, it's not going to go back. And part of that normal is going to be, you know, how do we sort of like look after this group of people with comorbidities in a much more patient-centered, focused way? And I mean that in terms of everybody working together, remove the silos, and also I think in terms of there's going to be a huge push on mental health as well. If we go into recession now, then actually we've got another huge number of cohorts of people who are going to require a lot of assistance and support. So I think we need to redefine what normal primary care is, what normal health care is, and what the expectations are. I think we really have to redefine expectations from ourselves as patients, our expectations of each other, and I think our expectations, government expectations of the health system as well.
Brilliant, thank you. And same question to you, Mike.
Yeah, we're going to have a huge backlog of work to do. I see the NHS having to focus on urgent and emergency work, for a good period after this. So yeah. What that means for some of the other elective work that we do, the quality of life stuff, I suspect that the private sector is going to play a big part in trying to get us back on track with some of those things. But depending on how long things go on for, depending what deterioration we've seen in performance target, depends whether there's a less emphasis on delivery of actually performance targets per se, and that we have a different opportunity to actually look at health outcomes as our drivers, rather than specific measuring specific parts of a patient pathway which do nothing for actually system working. So nobody knows where it's going to end up, but I think with this there's going to be a sort of a difference in terms of workload that the NHS has to undertake.